Great. Thank you. Now I turn it over to Senator Lujan.
Thank you much, Mr. Chairman, and thank you all for being here today. The way I'm looking at this is we need technology to help improve health outcomes, reduce health disparities, not exacerbate them. And it's clear that AI has the power to do both, which points me to the realization that AI is only as good as its inputs. If it's machine learning, it's going to learn based on what exists and what it's done and all the fun stuff that gets put in its way. Well, it seems to me that AI has a diversity problem. And what I want to illustrate here is a recent study from the Journal of the American Medical Association. Researchers reviewed it and said that of the 70 publications that compare the diagnostic decisions of doctors against AI models across several areas of medicine, most of the data used to train those AI algorithms came from just 3 states: California, New York, and Massachusetts. It seems that there's a diversity of data problem by population, by gender, by geography, and all the rest. Now, Dr. Mandel, do you agree that gathering data from homogeneous patient population teaches the AI tool to serve only that population?
I do agree. And the ability to get data not just from the highest performing health systems that are wealthy enough to have teams in their IT departments that can extract data and make it available, but from the edges. We should be able to get data from all of the electronic health records out to the federally qualified health centers. And in order to do that, we need interoperability. And the interoperability should enable us to get data to train algorithms and to monitor algorithms. And there's another area that's a little more hidden where these algorithms are being developed that could limit diversity. And in the large language models, the models are further trained after they're been developed on the data, which already may lack diversity. They're trained with something called reinforcement learning with human feedback, where people tell the AI whether it was right or wrong when answering certain questions. And so we actually need a diversity of staff who are doing the reinforcement learning as well, so that we get the right mix across multiple perspectives. So the issue you bring up is extremely important. It's demonstrated over and again that that lack of diversity in the data leads to biased conclusions that do not serve the full population well.
So as a follow-up, Dr. Mandel, is it important to include this at early stages or later stages? And if the answer is yes, why?
The early stages is much better so that the models are developed with less bias at the beginning. That bias can become entrenched and harder to fix later. And so technically, far better to try to solve the problem early with diverse data and appropriately diverse reinforcement learning staff, and rather than just trying to correct the bias later. Absolutely.
I appreciate that very much. Other examples that I've found with the help of the team are that AI trained mostly on chest x-rays from men will perform poorly when a clinician applies it to a female patient. An algorithm for diagnosing skin cancer on dermatologic photos will botch the diagnosis if the patient is dark-skinned, and most of the training images come from fair-skinned. I think these are obvious things that are happening in this space, that technology such as what I'm wearing as well has been proven that when you're trying to capture information from someone where those that were in the room developing that technology may have been one skin color versus another, maybe it was not obvious to those in the room that they should have included pigment awareness and challenges when they were trying to grab this technology. So I'm hopeful that we can be smarter about this and that this can be included so that the same problems that have been identified in the lack of diversity when it comes to clinical trials of drug treatments are not replicated now that AI is on the boom and on the build and all the rest. So I have lots of other questions, Mr. Chairman. I'll submit them into the record, but I thank you very much for this important conversation.